Hello and welcome back to The Left Unleashed. Today we are going to be unpacking Labour's decision to abolish NHS England and the broader reforms to the NHS, which kind of represent a significant ideological shift away from the founding principles of health service, which were universality, public ownership, and care based on need rather than the ability to pay. So we're going to break this down in each area. We're not just going to do that, but we're going to offer solutions as well. Real socialist, democratic solutions. So first up is centralisation of power and loss of local autonomy. So what's the problem with that? Well, abolishing NHS England means the Department of Health and Social Care will have direct control over the management and strategic direction of the NHS. This increases the risk of political interference, where short-term electoral priorities may well override long-term healthcare planning. Centralisation, which could reduce local accountability and responsiveness, creating a one-size-fits-all approach that fails to address regional health inequalities. So why does this matter? Well, it matters because the NHS was founded on the principles of democratic accountability to the public, not to central government ministers. Health services should reflect local needs and priorities, which vary significantly based on socioeconomic, demographic, and geographical factors. Over-centralisation contradicts the principle of empowering local communities and workers. So what's the solution? Decentralised regional health governance. We need to re-establish regional health authorities with direct responsibility for planning, commissioning and delivery of services. Regional health authorities should be democratically accountable through locally elected boards, including healthcare workers, unions and patient reps. Ensure that these regional health authorities have strategic control over budgets and resource allocation to address local health disparities. We need participatory budgeting and democratic oversight, where local communities have a direct say in how the NHS resources are allocated. We need to create local health councils composed of patients, healthcare professionals and union reps to monitor healthcare provision and recommend improvements. We also need independent oversight and a policy setting body. We need to establish these to set strategic objectives for the NHS, which are separate from day-to-day political control. Again, the board should be composed of healthcare professionals, patient advocates, and public health experts who have a mandate to ensure equity and quality of care. Next is the workforce cuts and decreasing morale. The proposed restructuring is expected to result in up to 30,000 job losses in NHS England, DHSC, and integrated care boards. Loss of admin staff and support staff could potentially increase the workload on clinical staff, exacerbating stress and burnout. Recruitment and retention remain major challenges, with vacancy rates in key sectors like nursing, mental health, and general practice remaining high. Again, why does this matter? Well, the NHS was built on the labour of a committed public workforce. Undermining that workforce contradicts the socialist principle of valuing and protecting labour. Austerity-driven staffing reductions ultimately reduce patient care quality and increase health inequalities. From a left-wing perspective, we should be investing in healthcare workers, which is essential to improving patient outcomes and reinforcing the NHS's public service ethos. So what's the solution? We end compulsory redundancies. We guarantee job security for NHS staff affected by the restructuring. We need to establish redeployment programs to place displaced admin staff into frontline support roles. For example, patient liaison, mental health support. We need to expand workforce capacity through investment, introduce fully funded training programs for nursing, midwifery and allied health professionals. We need to restore and expand nursing bursaries and student loan forgiveness for medical professionals who commit to working in the NHS. We need to fund additional training places for GPs with targeted incentives for underserved areas. We need to introduce national pay bargaining and improve conditions. We need to reinstate these across the NHS to ensure parity of pay and conditions. These also need a link to inflation and the cost of living. We need to introduce a national minimum staffing standard to protect working conditions and prevent burnout. Next is the risk of increased privatisation and marketisation. Again, what's the problem with that? Or the increased role for private providers in tackling waiting lists and reducing backlogs creates a long-term structural dependence on the private sector. Private companies will often cherry pick, and they'll cherry pick profitable services, for example, elective surgeries, while leaving more complex and expensive care, the likes of mental health, chronic disease management, to the NHS. This erodes public sector capacity and weakens the NHS's ability to deliver comprehensive care. Again, why does this matter? Well, privatisation contradicts the fundamental principle of the NHS as a universal, publicly owned service. A two-tier healthcare system based on ability to pay undermines the principle of care according to need. Market-based incentives distort healthcare priorities, shifting focus from patient care to profitability. Again, what's the solution? Well, we ban private sector contracting in core NHS services. We legislate to prevent NHS funding from being used for contracts with private providers in essential services, such as A&E, GP services, maternity care. We ensure that private sector involvement is limited to non-clinical areas, for example, infrastructure maintenance, rather than patient care. We should be investing in public sector capacity. We need to fund the construction of additional NHS-owned diagnostic and surgical centres to reduce reliance on private providers. We need to expand public provision of mental health and social care services to reduce waiting times. We should introduce a public interest test for NHS contracts. We should require all NHS contracts to pass a public interest test, demonstrating that public provision cannot meet demand before allowing private sector involvement. We need to ensure that all healthcare providers, public or private, meet the same staffing, pay and working condition standards. Next is service disruption and inefficiency. The problem? Well, major organisational restructuring risks diverting attention and funding from frontline care. Patients may face increased waiting times and fragmented care during the transition. Uncertainty over management structures could create bottlenecks in decision-making and service delivery. So again, why does that matter? Well, it matters because the NHS should prioritise stability and continuity of care, particularly for vulnerable patients. Organisational efficiency should not come at the cost of patient care. A well-functioning integrated health system is necessary to deliver universal healthcare effectively. So what's the solution? Well, phased implementation. Over 5 to 10 years, say. Roll out reforms incrementally with pilot schemes tested in selective regions. Ensure that existing services remain unaffected during transition periods. Provide interim funding to stabilise service delivery. Ring-fence frontline care budgets. Guarantee that funding allocated to restructuring does not reduce operational budgets for hospitals, GPs and community services. Introduce a legal obligation for the government to maintain real-term increases in NHS funding. Enhance integration through public sector partnerships. Strengthen collaboration between NHS trusts, local authorities and social care providers to deliver integrated care. Ensure that social care remains publicly funded and integrated with NHS services to reduce hospital discharge delays and improve patient outcomes. Next up is democratic accountability and public ownership. So the problem, NHS reforms have been introduced with minimal public consultation and limited involvement from healthcare professionals. The new system increases ministerial control without enhancing public accountability. So again, why does it matter? Well, public ownership and democratic accountability are core socialist values. The NHS should be managed and shaped by those who provide and use its services, not by political appointees. So what's the solution? Well, we introduce a national NHS charter, enshrine the principles of public ownership, free care at the point of use, and universality into law. Require all future reforms to undergo public consultation and parliamentary scrutiny. Strengthen union and worker reps. Guarantee NHS workers representation on all strategic boards and health planning bodies. Recognise healthcare unions as key partners in negotiating staffing levels and working conditions. Establish a permanent citizens' assembly on healthcare. Create a standing citizens' assembly to provide ongoing public input into healthcare policy. ensure the assembly is composed of a cross-section of the population to reflect its diverse needs. We need reforms that prioritise public ownership, local accountability and workforce protection, because these can strengthen the NHS without undermining its founding principles. Our vision for the NHS should focus on restoring democratic control, expanding capacity and ensuring universal, high-quality care for all.